in your book on good energy that you urge readers to consider psilocybin-assisted therapy. You began using illicit psychedelic mushrooms. I mean by saying that you heard an internal voice whispering to you saying, it's time to prepare.
I do believe Americans are ready to hear about spirituality as it pertains to medicine.
Senator Marshall defers to Senator Collins.
Thank you, Mr. Chairman. Welcome, Dr. Means. Addiction and drug overdoses are a major problem for families and communities in my state of Maine and across the nation. I am concerned that in your book on good energy, that you urge readers to consider psilocybin-assisted therapy. You also said that you were inspired to try psychedelics in what I can only describe as an internal voice that whispered, it's time to prepare. Illicit drug use remains a huge problem in this country, and this didn't happen in your teen years. According to your book, in 2021, you began using illicit psychedelic mushrooms. So my questions to you are twofold. One, do you stand by what you said in your book, encouraging people to try psychedelics? And second, as Surgeon General, should you be confirmed, how would you speak to the American people about the use of illicit drugs?
Thank you so much, Senator Collins. And I also thank you sincerely for engaging so deeply with my work and learning about me. This is a very important question. And I would start by just saying that I believe what I would say as a private citizen is in many cases different than what I would say as a public health official. Joining a team where the purpose of this role is to communicate absolutely the best evidence-based science to the American people to keep them safe, thriving, and healthy. And when it comes to psychedelic therapy for mental health issues, I think the science is still emerging. And so it would certainly not be a recommendation to the American people to do that under no circumstances. I do believe that there is exciting work being done in this area that needs to continue on psychedelic therapies for PTSD and veterans, for mental health issues. And some of the researchers who are doing this work have said it's some of the most promising and exciting of their entire careers. So I look forward to following that, but to be very clear, under no circumstances would I recommend that to the American people in this role. Our illicit drug use problem in our country is monumental and severe, and I look forward to working with you on these issues that are so important.
What did you mean by saying that you heard an internal voice whispering to you saying, it's time to prepare?
Yeah, in that passage of the book, I'm referring to my mother's passing, which happened, she got a diagnosis of pancreatic cancer about a week after that experience. And in my meditations and prayers at that time, I was having a deep sense that something ominous was coming. And so that's what that's referring to. I think when I speak of spirituality, I do believe Americans are ready to hear about spirituality as it pertains to medicine. 80% of Americans are spiritual or religious. There's amazing evidence coming out of Columbia University, the lab of Dr. Lisa Miller, that spirituality has a large impact on health outcomes. And, so certainly that's a personal anecdote. But I again am committed to sharing only the best solid science with Americans on how to be healthy.
I understand totally what you're saying about spirituality, and I'm sorry about the loss of your mother. It's the link to illicit drugs that I'm having a hard time with. But I have very little time left, so I want to go to another issue, and that is in the staff interview when you were talking about wasteful spending, you referred specifically to money that NIH spent on Alzheimer's research that, quote, proved to be fraudulent. And you were referring to the amyloid plaque research replication issue that was discussed in the New York Times. That story, however, has been largely debunked and countered. So I just want to make sure that I know for certain whether you are for vigorous research on looking at a wide variety of factors when it comes to Alzheimer's disease and other dementias.
Unquestionably, full-throatedly, yes. This is one of the most devastating diseases facing Americans today. It's one that I'm very passionate about, particularly in light of research showing that early onset Alzheimer's dementia in as early as the 50s is starting to rise at a significant rate. I believe that we need to be studying, like you said, all the different medical, genetic, lifestyle, environmental factors that can be contributing to this. And when I look at the research that, some of the research that I'm very excited to elevate in the conversation, if I'm confirmed, I'd point to the Lancet study from 2024 about the modifiable risk factors for Alzheimer's dementia, which I'm sure you're familiar with, which showed that with 14 modifiable factors, we could reduce 45% of Alzheimer's dementia cases. This is incredible. This isn't really the type of research that we've been hearing from the medical community. We hear a lot about drugs. We hear a lot about interventions that slow decline once we're sick. But that's the type of research, like from the Lancet, major medical journal, that I really look forward to elevating, supporting further research like that can really help Americans be empowered to prevent this disease when we can.
Thank you.
Senator Kim.
Thank you, Chairman. Thank you for coming out, and congratulations on the new baby. I wanted to just ask you about the role of the Surgeon General, the different aspects of it. So one of it is about issuing public health advisories, is that correct?
Yes.
I wanted to just ask, are you currently able to write prescriptions for patients?
I have not been seeing patients over the last several years, and so I currently, with the status of my license that I voluntarily put on an active status, which I'm sure what you're getting at, cannot prescribe a prescription right now. However, if I were to work with the Oregon Medical Board to reinstate that, it's very possible to do. And
is that something you're planning to do?
I'm not planning on prescribing prescriptions to Americans.
But are you planning to reactivate your license?
My path in medicine, I spent 4 years doing surgeries and seeing patients in clinics, and that one-to-one medicine, it's valuable, but my path took me down a different road to have a one-to-many approach to affect the root cause of why we're sick in America. And I've had a very successful. So you're saying you're not going to pursue reactivating your medical license in taking this job. Is that correct? I do not plan to reactivate because I'm not going to be seeing patients in this role. So it would not make sense to do that. In fact, for physicians, if I could just clarify, because this has been a point of severe misinformation from the media, for any doctor in a state where you are required to put your license on inactives if you're not seeing patients, I would imagine that many physicians in public health service who aren't seeing patients would have to put their license on inactive status because they are not seeing patients unless they choose to continue to do so while in office.